All right, well, it's right at the noon hour, so we'll get started. Welcome to our IDRPP's Autism Echo. If you've not taken a minute, if you'll put your name and contact information into the chat. As you saw, we are recording today's session. It helps us with education and quality improvement. These recordings are stored on our webpage as well as our Canvas page. So if you ever want to go back and review them, you can always find them. Um, if you don't want to be recorded, you can just leave. I need to give a huge shout out to the Autism Council of Utah and the Autism Awareness License Plate for providing the funding for this project. They have done a wonderful job of making sure that we're helping everybody learn those early identifications and identifiers of autism. I hope that you're joining for the remaining of our sessions. We have some coming up about physical development in autism, autism and sleeping, some family perspectives, a little bit about what applied behavioral analysis is. So hopefully you'll join for the remaining of these sessions. Key components of an echo is really all about that professional networking. So if you feel comfortable and you're not eating, please take a minute and turn on your camera. It just lets us know who's on the call so that we can see everybody's faces and know who out there in the state of Utah is working with kids and families with autism and that we can reach out. The other portion is that we will always have a speaker. So someone who tells us or gives us a little bit of information. And then we have a case presentation. And the case presentation, we answer 2 or 3 questions from the person. And you guys all get to share all your amazing and wonderful ideas and recommendations and resources. So again, just that it is that interactive. Make sure you ask your questions. We have wonderful experts on this call that would be able to answer those for you, or at least know where to direct you when you have those questions. We do talk about sensitive information, so please remember to de-identify, don't use first and last names, don't say where they live. If you have any questions, you can reach out to one of our great hub members. They all have an asterisk in front of their name, so they're easier to find on chat. You can take a minute and rename your profile. Tell us where you're from, what your discipline is. Again, it's just a way to learn who's on the call and where we're at. Raising your hand. We've all used Zoom for quite some time now, painful as it is. But in case you don't, here is the way that you can raise your hand. In order to get a certificate of attendance, we do ask that you complete the survey. The survey will be dropped in throughout today's session into the chat, as well as emailed at the end of the session, either today or tomorrow. So we do ask that you complete that survey, and then we email those certificates out once a month. Canvas is where we store everything. So if you would like access to our Canvas page, you can always email autismecho@aggies.usu.edu and we will get you registered for the Canvas page. Always want to do a plug for those case studies. They are a great way to get information, share things about real life situations, and one of the favorite parts and just going into those breakout sessions and talking about those cases. I'm really excited today to have Stephanie Solgla. She's going to do the case for us and know that she's going to get some amazing recommendations with that. We do have our Facebook, Instagram, and LinkedIn pages where we share information and about sessions, about upcoming conferences, things that we get. So if you've not done so, take a minute to follow us. And then just letting you know that our session in January. We'll be back to the fourth Wednesday of every month. This one, I just didn't think anybody wanted to join an echo on Christmas, which is why we're doing it on a Thursday. So hopefully you'll all join us for our January session. I'm going to stop sharing. We have Colin Kingsbury from Department of Health and Human Services, and he is going to talk to us about autism, the wait list, and moving from a wait and see approach. So, Colin, go ahead and take it away.
Awesome. Thank you so much. So I'm going to present here for you all. And hopefully you can see my screen. Thank you all so much for attending. My name is Colin Kingsbury. I work with the Department of Health and Human Services in the Division of Family Health and the Office of Children with Special Health Care Needs. I have two kind of main duties, the Autism Systems Development Program and the Adult Autism Treatment Account. We have a lot of information in our slideshow today, so I have a co-presenter. And I don't know, Maddie, if you want to introduce yourself here.
Sure. Hi, everyone. My name is Madison Mitamura, and I am the study coordinator for URAD and Utah ADDM. And I will talk in a couple slides what those acronyms mean.
Cycling back to my program, the Autism Systems Development Program. Program seeks to advance, educate, and empower the lives of individuals affected by autism in Utah. We have a few main goals, which is to monitor occurrence, reduce the age of first diagnosis, facilitate research, and provide education and outreach. URAD, I will pass that off to Maddie for that one.
All right, so URAD is the Utah Registry of Autism and Developmental Disabilities, and it has been measuring the prevalence rates of autism and other special needs classifications in Utah since 2002. And then Utah ADDM is the Autism and Developmental Disabilities Monitoring Network, and it is the only collaborative network to track the number and characteristics of children with autism in multiple communities in the U.S. The ADDM network was launched in 2000, and Utah ADDM has been proud to announce that we've been part of this network for 7 out of the 12 study years. URAD has a handful of goals. We estimate the number of children with autism and analyze how this estimate has changed over time. We determine the risk factors and causes of autism spectrum disorders. We provide information on the characteristics of children with autism, including sex, race, ethnicity, co-occurring intellectual ability, and age of evaluation and diagnosis. We facilitate measuring and tracking of treatment outcomes. We improve coordination and cooperation between agencies, programs, and service providers, and we try to understand the impact that autism spectrum disorders and related conditions have on children, families, and communities within Utah. So now let's just take a closer look at what's going on in Utah with autism. We're going to examine the state's prevalence, what autism looks like in Utah, and what insights our data provides regarding the age a child is diagnosed with autism. Right now, there are approximately 85,000 individuals in Utah with autism, and this is based on our 2020 data. It's important to note that in addition to autism, in Utah, individuals will also have 4.6 other diagnoses. And some of the most common co-occurring conditions are ADHD, anxiety, depression, intellectual disability, and seizure disorders. All right, so now we're going to take a look at a graph. It might be a little hard to see. So this is looking at how Utah compares to the overall national average. So in blue, you can see Utah, and in purple is ADDM, which is the national average. In 2008, you'll see a big spike, and that is due to the fact that we had a small sample size. We were only looking at Salt Lake County as compared to our every other study year where we're looking at Salt Lake, Davis, and Tooele counties. And in 2020, you can kind of see that the national average passed us and we fell a little bit below. And this is just a deeper dive into that. So 1 in 40 or 2.5% of 8-year-old children were identified with autism in that 3-county area. I talked about Davis, Tooele, and Salt Lake County. And this percentage aligns pretty closely with the national average at 2.8%, where the CDC was tracking in 2020. For our 4-year-olds, we were at about 1 in 79 or 1.3% of children were identified with autism in that 3-county area again in Utah by ADDM in 2020. And this percentage is lower compared to the overall national average, which was 2.2% in all communities tracked by the CDC. So some key takeaway messages from ADDM. Utah's estimated prevalence of autism in our 8-year-olds increased slightly from 2.2% in 2018 to 2.5% in 2020. 4-year-old children in 2020 were more likely than 8-year-old children in 2020 to be identified with autism by the time they were 4 years old. So this suggests that there have been improvements in Utah to identify autism at earlier ages. The prevalence of suspected autism suggests that many 4-year-old children in Utah have experienced or may have experienced challenges accessing assessments for autism in 2020. And this finding supports continued efforts in Utah to expand our diagnostic strategies to improve identification at earlier ages. Our autism prevalence was higher among children from lower socioeconomic backgrounds, and this shows improved access to diagnostic and treatment services across the socioeconomic spectrum. And lastly, we have more to come. We recently concluded our study year for 2022, and we're excited to announce that updated data will be released in the spring. So we look forward to sharing that data with everybody. And as part of our study year for 2022, we collaborated with Janelle Preston, our Learn the Signs and Act Early ambassador, to collect data to study autism screening and referral practices of Utah providers. And we did so by collecting the MCHAT, the POSI, and the STAT, even though the STAT was used more as a diagnostic tool. And we did this by reviewing screening records for 4-year-olds that we knew had autism by the time they turned 4. So this is a hindsight study. So we were able to look directly at the children that we knew had autism by the time they turned 4. And again, we look forward to sharing that data with you guys sometime in the spring.
Thank you, Manny. Appreciate that. So now I'm gonna jump back in. We're gonna take a closer look here. Not at the bad guys book that my nephew Tyler is looking at. So when we first got this Autism Council of Utah, which I'm on, Janelle sent us a grant request for this, and her statement of need was this, and it really spoke to me, so I just wanted to read it. In the state of Utah, we are below the national average for identifying individuals with autism. The national average of early identification of 4-year-olds is 2.2%. However, in Utah, only 1.3% of 4-year-olds are being identified with autism. While Utah is making strides in early diagnosis, families and children are still missing critical periods for early intervention services. Early identification, screening, and detection help identify appropriate intervention, significantly reducing the symptoms and severity of the disorder. And I just really love that because, I've worked around the data for 12 years. I had never thought of it that way. So I thought it was kind of important to help me reframe everything I think of and look at in this context. And then kind of thinking about, Ty here, he was diagnosed when he was almost 9. And that's my nephew. And I'm supposed to be really good at getting people into services. And so sometimes it's really hard and we miss kids for a variety of reasons. And hopefully we can kind of take a look at some of those reasons today. This is another graph, yet one more. CSHCN put this out in one of our block grants a few years ago. This one really speaks to me because you can really kind of see not only 4, 8, 12, 16 and how that line goes up. You can also see what's going on in our rural and frontier locations. Those kids are so important too. Those rates clearly are much lower. And as you can see, our 4-year-old rates are very low. This isn't a longitudinal study looking at following a birth cohort, but URAD has done those, and those numbers are pretty similar to. I think my key I always like to say here is when you are looking at these children, they've always had autism spectrum disorder. They just weren't being diagnosed with autism spectrum disorder. And I see we have a question, so I will let Joe interject here.
Yeah, this is from Cami. She says, what do you mean by frontier locations? If you can just expound on that.
Yeah, so that just is a federal designation of the populace in those counties. So Salt Lake is a great urban county, so that's urban. Rural county might be like Wasatch County for now. And then frontier would be something like San Juan. And those are just some examples. All right, so as we're looking at autism screening, kind of wanted to just go over like what are the red flags for autism? What does an autism screener look like? Are children who are screened for autism diagnosed at an earlier age? So does it actually work? And why aren't providers referring kids for a comprehensive eval? We have a lot of early intervention providers on this call, and I think you guys end up doing a lot of the legwork, but we'll get into that a little bit later. So some signs and symptoms of autism. So I got these from the CDC website. We can break these down into 3 categories that we'll go into. First is social communication and interaction skills. Next is restricted or repetitive behaviors or interests, and then other characteristics. It is important to note that all children with autism may not have all or any of these behaviors listed. These are red flags. These are things to look for. If you were in attendance for Dr. Chuck's presentation last month, he really kind of went into this more and in great detail that a practitioner can. So, if you haven't seen that, please go back and look at that as well. So I'm not gonna read all of these, but these are signs and symptoms to look out for. I am going to quiz y'all a little bit later to see which ones pop out to you. These are the ones that always pop out to me. So avoids or does not keep eye contact, does not respond to their name by 9 months of age. The child does not point to show you something interesting by 18 months of age. And they do not notice other children and join them in play by 36 months of age. These ones pop out to me because these are signs and symptoms that my family members with autism had. And so it would be interesting for other folks who have children or working with children with autism, what ones pop out to you, just to kind of walk through that. We've also got this restricted or repetitive behaviors or interests. So people with autism have behaviors or interests that may seem unusual. These behaviors or interests set autism apart from conditions defined by problems with social communication and interaction only. Some of these ones that really pop to me are lines up toys or other objects and gets upset when they're changed. My nephew Ty, who you saw all the pictures of earlier, he will line up all his Imaginext. And they got to be DC villains, DC heroes, Marvel villains, Marvel heroes. And sometimes you got some weird other guys that have just kind of filtered in from abstract things, and we don't really know what to do with those. But we find a place. And, so that's an example. Plays with the same toys in the same way every time. Gets upset by minor changes, has obsessive interests. Don't know if you noticed, but all the pictures with Ty, he has Curious George. He has an obsessive interest with Curious George. Must follow certain routines. Flaps hands, rocks body, or spins self in circles. Those are always the ones, like I say, that pop out to me. What of these pop out to you all? Think about that as we kind of move through. Here are some other characteristics, and these are important as well. Delayed language skills, delayed movement skills, delayed cognitive or learning skills, gastronomical issues, unusual motor reaction, and that anxiety and stress and excessive worry, and lack of fear or more fear than expected. I think if you have someone, a loved one in your life with autism, you probably know about this anxiety, stress, or excessive worry. It's one that I think about pretty much every day. So if you all have any red flags that popped out to you that you want to throw in the chat, or we can make this interactive. Even if you want to raise your hand and let me know, that's great too. But like I say, those are red flags and things to look out for. Those are the ones that pop out to me because of my personal experience. So there might be others that pop out to you as well. All right. Yep. Let's see, let me scroll down here. Lack of response to bids for attention, not having joint attention, non-integrated primitive reflexes, lack of eye contact and a social smile, limited gestures. Yep. All right, so as we're thinking about all of those kind of nebulous things, and we think about identifying autism early, that can be really, really difficult for pediatricians and practitioners and early intervention providers, as we've seen from the data that Maddie showed. So there are those tools, the MChat and the POSI, and those are screeners for autism that are designed to kind of walk you through a structured screening and help you determine if the child should be referred for an evaluation or not. I always kind of like to walk people through the MChat because it's a tool that is misused a lot and misunderstood. And as I kind of think about how old this tool is, I think the last update to it was in 2009. With this is the revised edition. I always kind of wonder why. So we'll walk through it today. The MChat-R, or the MChat revised, which is the modified checklist for autism in toddlers, can be administered as part of a well child visit, or maybe used by specialists or other professionals to assess risk of autism. It is not a diagnostic tool. Like I said, it's a screener. The primary goal is to maximize sensitivity, meaning to detect as many cases of autism as possible. So not all children who score at risk will be diagnosed. To address false positives, there's a follow-up portion. This is the forgotten portion, but it's very, very important. We'll talk about that later. But even with that, they kind of expect a significant number of children who screen positive not to be diagnosed. The goal here is to overscreen. You don't want to underscreen. That's bad. There's kind of a debate on whether it does overscreen or not. Kind of depends on who you ask. It can be scored in less than 2 minutes. It can be done online. I know we have our wonderful partners from Help Me Grow on this call. They offer the MChat to parents, and it can be sent to their phone. And if I'm remembering correctly, mom can even fill out like the first 10 questions and then come back to it and do the rest. So it's very user-friendly. Special shout out to Help Me Grow Utah for offering that services. Okay, so let's kind of talk about how this thing is scored. For all items except for 2, 5, and 12, the response no indicates autism risk. And for 2, 5, and 12, yes indicates autism risk. What does that mean? You will see in a minute, so we'll come back to that. Low risk is this. So if a child scores 0 to 2 and they're younger than 24 months, you just screen them again and, 6 months later. Medium risk is when they score 3 to 7. So this is where that follow-up portion comes in. Now, if you do the MChat and you get a 3 to 7 and you administer the follow-up portion and they're still above 2 or higher, the action required is to refer the child for a diagnostic evaluation and eligibility evaluation for early intervention. There's those 2 key components, a diagnostic evaluation and EI. Sometimes you'll see one of those and not both. If the score of the follow-up is 0 to 1, they've scored negative, and you can just they can be rescreened at further well-child visits. There's also this high risk category. Oh, I see we have a hand up there.
Sorry to interrupt. I just going back to noticing stuff about kids, the autism with kids. Someone asked if they've ever noticed a connection between kids on the spectrum having excessively long eyelashes, if there's any connection between the two, like a sensory thing, I'm guessing. I don't know if anyone's heard anything about that.
I have not. I don't. That's an interesting observation, though. But I'm not aware of that. Right. Okay. So we are about to jump into our high risk kids. So this is an interesting category. So this is if they score 8 to 20. So if this is the case, you can bypass the follow-up portion and immediately refer for that diagnostic evaluation and eligibility evaluation to early intervention. So let's jump into it. This is the MChat. This is all 20 questions. I know you can't read that on the screen right now. So we're going to take a look at these questions bit by bit. So the first 5 questions are, number 1, if you point at something across the room, does your child look at it? Simple yes or no. When I say simple yes or no, this can be very confusing. I remember when my sister was doing the MChat with my mom, they had very disparate points of view on this. It even caused a little bit of an argument. So for example, if you point at a toy or an animal, does your child look at the toy or animal? Question number 2, have you ever wondered if your child might be deaf? Question 3, does your child play pretend or make believe? For example, pretend to drink from an empty cup, pretend to talk on a phone, or pretend to feed a doll or a stuffed animal. Does your child like climbing on things? For example, furniture, playground equipment, or stairs? And does your child make unusual finger movements near his or her eyes? Does your child wiggle his or her fingers close to their eyes? Questions 6 through 10. Does your child... Oh, I see we have a question here.
So another question is there, do you know of any info of larger head circumference with autism?
I do not. Okay, so does your child point with one finger to ask for something to get help, pointing to a snack or a toy that is out of reach? Does your child point with one finger to show you something interesting, pointing to an airplane in the sky or a big truck on the road? Is your child interested in other children? For example, does your child watch other children, smile at them, or go to them? Does your child show you things by bringing them to you and holding them up for you to see, not to get help, but just to share, showing you a flower or stuffed animal or a toy truck? Does your child respond when you call his or her name? For example, he or she look up or talk or babble, or stop what he or she is doing when you call for them. When you smile at your child, does he or she smile back at you? Does your child get upset by everyday noises? For example, a scream or a cry or a noise such as a vacuum cleaner. With Ty, who I showed earlier, it's babies. He really doesn't like babies because they scream a lot. It's always fun when you're around babies and him. Does your child walk? Does your child look you in the eye when you are talking with him or her, playing with him or her, or addressing them? And does your child try to copy what you do? For example, wave bye-bye, clap, or make funny noises. If you turn your head to look at something, does your child look around to see what you are looking at? Do they try to get you to watch him or her? Do they look for praise or say, look, or watch me? Does your child understand when you tell him or her to do something? If you don't point, can your child understand, put the book on the chair or bring me the blanket? If something new happens, does your child look at you in the face to see how you feel about it? So if you hear a strange noise with them, do they look to kind of see like how mom or dad is reacting? And does your child like movement activities, being swung or bounced on your knee? So those are the walkthrough for the MChat questions. We also have our follow-up questions, like I mentioned earlier, that these ones are so important, kind of distilling out what did all that mean. And I think as we've walked through a ton of stuff today, we walked through all these red flags, we've walked through the MChat, you are really going to recognize for people with autism in your life, yes, that one does not apply. I'm thinking about this question and, it would be hard to score a 20 on this screener. And, like they say, when you've met one person with autism, you've met one person with autism. So these screeners and these red flags are doing the best they can to distill something down for us to use. Okay, so I hope right now you can see the MChat RF. Is that the follow-up portion? Is that correct? So we've exited the, okay. So these are the questions that are used to kind of clarify what we're looking at. For example, number one, I talked about this one that, my mom and my sister had a spirited argument about. So if you pointed something across the room, does your child look at it? My sister and saying no. So we would say, if you point at something, what does your child typically do? And she would say she ignores the parent. So we're going to hit a yes there. Might be look randomly around the room. Might be looks at the parent's finger. So then that's going to take us down to yes, only to past examples. Yes to examples both from pass and fail, and yes only to fail examples. Okay, so she's going to fail in this regard. So we're gonna go down here. Which does she do the most often? Most of the time she fails. So we're kind of clarifying out that question. With grandma answering that question, you're going to say, okay, if you point at something across the room, do they look at it? please give me an example of how they'll respond. Do they look at the object? Yeah, well, no. Do they point at the object? No. Do they look and comment on the object? No. Looks if the parent points and says yes, no. So now we've kind of clarified that question and we understand, yeah, that's a true fail. And so it really kind of helps them understand that in the real world and what that looks like. This is one of our special questions, number 2. So you reported that you have wondered if your child is deaf. What led you to wonder that? They often ignore sounds, yes or no, or they often ignore people. So if we have a no to both, it's a pass. And then we can go down to, has your child had a hearing screening? And then if no, they should get that hearing screening. And sister program here at Children with Special Healthcare Needs, our early hearing and detection is always great at that. Best in the nation. If they answer yes to either of these questions, so maybe they often ignore people, that's a fail. And then you can once again ask, has your child been, their hearing been tested? And it may have been already, or it may not. And they may also need to have that hearing question. We will skip that one and we'll go down once again to number 5. So does your child make unusual finger movements near his or her eyes? So if we have a yes on here, we're asking the parent to describe that. What does that look like? So does he or she ever look at their hands, move fingers when they're playing peekaboo? So maybe they look at their hands. We can say yes there. So that's going to take us to the yes and move us through down to a pass. If they don't ever make unusual movements near their face, then they're just a pass. This is trying to capture like those sensory vision items. We're also, if we're looking to describe this, we're trying to get ourselves a fail here. We might say, do they wiggle their fingers near his or her eyes? Do they hold his or her hands up close to their eyes? Do they hold his or her hands off to the side? And do they flap their hands near their face? I feel like these are ones like with hand flapping that was very common and very popular to talk about probably 10 to 15 years ago. But it is still out there. I see we have a hand up for another question.
Yeah, so one question is, do you know the ages hearing screeners done in the public schools in Utah? And then once again, the MChat was put in the access to MChat was put in the comments, but yeah, do you know what
I think they all should have had.
In the public schools, when are they do the screeners?
Yeah, I'm not sure about the public schools, but with our early hearing and detection group, they should have those very early on. Maybe it's somebody in the chat might know that in my, if anybody here from my office is there. 3 years for public schools. Thank you for that.
Yeah, and I can tell you, I work with an early intervention company, and we can offer it. We just have to, you can request it from earlier intervention, but we don't do it regularly anymore.
Okay, so as we kind of look through these, as we're paused, I do want to pause and say, does anybody have any also broad questions about where we're at, this screener, how it works, and why it's important to do both the regular portion of the MChat and the follow-up? With that, we actually, thanks to being in the great state of Utah, which is a wonderful state for autism research and studies, we do have some hard data on the importance of screening. for autism. So this is included in the notes. I have a hyperlink to the publication here from Dr. Paul Carbone et al. And Teresa Gabrielson. I'll give her a shout out there because she's the best. And you can go on here, and what I love about this particular listing is they have an abstract that you can listen to. You just go on there and it's about 3 minutes and you can listen to Dr. Carbone tell you about this study and why it's important. So you don't have to go through and just say, wow, that's pretty intense study. I don't have time to read that. But some things that were very interesting that we pulled out here. About 73% of children in Utah were screened for autism. Family physicians were less likely to screen for autism than pediatricians. So you can kind of connect the dots on that with some earlier portions of the presentation. Most physicians did not complete that follow-up section, which, kind of goes to show you, like, parents might not understand the question. So that follow-up's important to help them understand what they are being asked. This is the one that I kind of cry about. Nearly half of physicians did not refer screen positive children for an autism evaluation. Yeah. And then a positive note, screen positive children were diagnosed with autism 10 months earlier than children not screened. That's 38 to 48 months for our folks in early intervention. We know how important the time is, even though that is outside of that birth to 3. And they were diagnosed 12 months earlier than children who were screened negative. So some of those false screen negative kids. So as we've rolled through this all, I'm gonna quiz y'all once again, and hopefully, if any of you that are there, you can win a free Krabby Patty as we go through these examples. Okay, so these are some composite examples in the real world. So this was a kid who was screened using the MChat, and we have a high risk for autism, and the note was no. So Mr. S. Bob here, he actually had scored 12. Does anybody know what went wrong here? All right. Well, since they scored a 12, they should have been referred for a diagnostic evaluation and an early intervention specialist. Yep. 12 is a high risk score. Yep, that's exactly right. It's another example. We have one pass with no concerns, referred for speech therapy, but not autism testing. This is where Patrick here scored an 8. Does anybody have any idea what went wrong here?
Again, the provider didn't really know how to use the test and referring for something else.
Yep, that's exactly right. Okay, this one, go back. This one's my favorite example. High risk for ASD, yes, but Mr. S. Ward has excellent social engagement in the office. Think about this one all the time because Ty, my nephew, whose pictures you saw, very much appears to have excellent social engagement when you meet him the first time, until you realize we're on a loop. So it is all entirely scripted out. So in those little bits of office time, they might not know if they actually have an excellent social engagement or not. I guess I kind of answered that one, so you guys are off the hook. So one thing I do like to say is we can make a difference. And one of the things that we need to do is know where to refer. You have your wonderful Maybe watch your early intervention providers, if they are referring for that early intervention piece. But if they are looking for that other component of a kid who's screened at risk for autism, we keep a pretty comprehensive list of autism evaluation providers in the state of Utah. This was actually updated yesterday, so we try to update this at least once a month. And what we have on this list is the name of the provider, all of their contact information, the insurances they take, private pay cost if they have to just pay out of pocket, a wait list if the provider has a wait list, the ages they serve, and if they have Spanish speaking or not. The reasons these are important is, well, number one, are they near where the family is located? That's not always the case. You hear horror stories of families having to drive all over the state to get an evaluation done, and that breaks my heart. Also, if the insurance covers it, always nice. And then wait list. It's funny when I first did these evaluation lists about 8 years ago, providers were like, don't put our wait list on there. We don't want people to know that we have a 2-year wait list. And then I don't know, sometime during COVID, a lot of providers, and as more and more private providers got out, they said, yeah, please put our wait list on there. We don't have a wait list, and we know there's a lack of people getting in to have their evaluations done. So we want them to know that we can get them in immediately. With that said, not all providers are comfortable diagnosing all kids. You can see particularly here, one has ages 2+, and then the one right below it has 18 months. So it's good to know what providers are comfortable with and who they're comfortable doing an evaluation for. So that might be a little bit different. And I always say when I'm talking to a parent, think about these like a pair of shoes. They might be right for somebody else, but they might not be right for you. Okay, so we have a hand up there for a question.
So 2 questions. One is the MChat typically done by parents, and then parents take the results to a doctor in order to get a full eval to get a diagnosis?
Yeah, that's a fantastic question. So the MChat should be done by the pediatrician or a professional. I think that there are some barriers in that kind of filtering here. There are some barriers in how that's done. So not everybody has a pediatrician, not everybody has a primary care physician. And in these other areas of the state, our frontier and rural counties, some parents might just kind of be on their own. So in that regard, once again, our wonderful partners at Help Me Grow Utah, they offer this so a parent can do it themselves. I always talk up the autism mom because they're the most fierce and courageous people. So like a lot of times what you'll see is that the mom will go out and learn about the signs and symptoms themselves. And they'll do an MChat or something online. Like I mentioned, this thing's everywhere, so parents can really find it. Yes, thank you, Janelle. The autism specific screener is recommended by the AAP at 18 and 24 months. And then, Joseph, I see you have another question. I'm wondering if it's about the list being available in Spanish.
Yeah.
Currently, it is not, but we're working on that. Unfortunately, I'm not a Spanish speaker, but so I'm going to have somebody help me translate it. But I think that's something we're going to push hard for in the new year. Once again, the link is here in the slideshow. I see it's been dropped in the comments as well. So you can find that where you want. There are some other autism navigation services out there, and they're all great. I haven't come across any that are bad. So this is one of many. Another great resource is the Utah Parent Center. People can call them and they can help you find an evaluation as well. So for my last slide here, it's just that question: is screening for autism important? So I'll leave that as for you all to decide and say thank you for your time.
So we will open it up to a few questions if people want to come off mute or put it into chat. Okay. I love all of that information. I just think it's so helpful and informative that the earlier that we can identify autism, again, the more likely we are to make an impact on the severity of the symptoms. So, and I always want to preach that a screening is just a screening. If there's any concerns, make that referral to the next step with it. And also just that early intervention does not need a doctor's recommendation or referral. They can just call and get that started. And so helping families know that they can get those services regardless with it. Okay, if nobody has any questions, then I'm going to ask Stephanie to talk so I can find you.
Hi, Janelle. I'm here.
I know, I just have to find you on my screen, that's the whole thing. Okay. And so Stephanie, I'm going to pull up your case presentation and just tell me when to go next. Okay. Oh. Okay, can you see it?
Yes.
All right.
So my name is Stephanie. I have a cold, so ignore how weird my voice sounds, but I have my degree in child development and I work at up to three doing autism service providers, going into homes and working with families with those things. Next. So I wanted to kind of present this case with a family on my caseload. So we have Winnie, who's a 33-month-old. She'll be turning 3 in just a couple of months and exiting our program soon. She's been in our program for about 9 months. With in-home visits. She doesn't have a formal diagnosis of autism. Parents aren't super concerned with that diagnosis. Their main concern is that speech and language communication. Some parent history. She lives with mom and dad, no siblings. In low income housing, there's history of like trauma and abuse, not with her, but with her parents. Her parents have experienced some of those things. Dad had cancer a few years ago, and from that was a traumatic brain injury, and that can kind of impact his learning. And then mom has some anxiety and depression. Um, and then there's not really a lot of family support as well. So that can kind of make things hard too with that support, especially with that of those early indicators of autism. So that's kind of the background, the area of concern. So one of the goals we're working on is that active engagement of just getting Winnie to interact with others. She moves around a lot, especially at the home visit. She's usually running around, going from thing to thing. She likes to climb on the tables. She likes to climb on everything. So pretty much everything is like taped down, secured. So she doesn't knock anything down, but she's a climber and a mover, and so kind of that active engagement and in interactions is kind of hard with that. You can go to the next one. Yeah, so some of the goals that we're working on again is that active engagement, and then parents are really focused on that language. And so they want her to use words and word approximations for requesting. She has made some good progress with like pointing and like making choices. So if parents hold up a drink, she's able to like make that choice of what she wants. So she has made some progress there. Some of the hard parts about visits is that mom talks a lot. about some things that are on topic, some things that are not so much on topic. Again, there's that focus on the language delay and not so much that engagement or interacting with others. Especially recently, they've insisted on keeping the TV on during visits because they're like, well, this is where she's engaged, this is where she's interested in, and then they're trying to focus on like teaching colors and shapes and emotions and just they're really excited that she's copying the shows, which is really great with that imitation, but they're really focused on her watching the TV, which can be kind of hard for that social engagement with others. Um, that next one, I think. So we tried a preschool class and we tried those community activities, which are just organized and planned by up to 3, just opportunities to work on skills outside of the home environment. But family, mom doesn't drive, so it's mostly dad that drives, and so that transportation is kind of an issue as well. Um, but they haven't been able to come to any of them, so that kind of makes it hard too. So some of the things that we want to discuss, I would love to get some input on is like, how do I engage and encourage mom to practice these strategies during visits instead of talking? Because sometimes I'll be like, well, let's work on just handing her different toys, and but she'll like interrupt and say like, oh, I do that. She does really great with that. And then she'll like start talking about something else. And I'm like, okay, great. And then another thing with that is how do I get an accurate picture of what she's doing when mom kind of over reports? Which I get as a parent. I want to brag about my child and like show all the exciting things she's doing. But it's kind of hard to help mom see that how that engagement is important. Um, so she'll report that when he plays with other kids while they're at the park, but she won't really engage with me during our visits. She won't really even acknowledge that I'm there. And so it's kind of hard again to coach mom on these things about interacting and engaging with others when mom's like, yeah, that's what she's doing. Um, so yeah, some help on that would be great. Um, I'm not, is there another slide after this journal? I think it's just just those discussion questions.
Okay, well, we are going to go into our breakout groups. So, Colin and Joe, your guys' breakout group is going to take question number 1. How do I engage and encourage mom to practice strategies during those visits? And then, Madison, your group is going to take question number 2. But you guys can also ask those in it however you want. Discuss that. I will be moving Stephanie in between the 3 rooms at different times. Steph, I'm going to send you a text to let you know when I'm going to move you.
Okay.
All right. You should all see your breakout groups. Does everybody see their breakout group? Brandon, do one idea from each group, and Madison, I'll start with your group.
Oh, it's gonna be hard to choose one. We had so many great points made in ours. But I'll just talk about one that we didn't have a chance to talk to Stephanie about just barely. Um, Actually, I'm going to do 2. I'm sorry.
You're
First,
good.
it was recommended to go to the location. So mom always talks about how Winnie was really good at interacting at the park. So why not go to the park with mom so that you can go and observe and see what's going on at the park or wherever it is where mom says that she's having good engagement with other children and her peers. And it can also be a good teaching time to encourage mom to go and engage in a way that is helpful for Winnie. Additionally, since you talked about how Winnie is very active and she's always moving around, try maybe like putting her in a high chair or something like that where she stays in one spot and you can really get her to focus on you and engage and build that rapport with her. And we did ask you what time you're visiting, and so we're not sure if it's around a meal time where you can kind of sit and be part of feeding and then kind of put toys in and begin playing with Winnie just to build that relationship and just kind of really get her to focus and then hopefully graduate into not needing to be in the high chair and kind of moving about the home or wherever you see her.
Great ideas. All right, Joe, what about your group?
Well, just like Maddie, my group came up with a lot of good suggestions, but I have two that really stand out that I'm going to share because she shared too. So, um, one is kind of help focus the mom by using like timers or reviewing the goals that she set up to go over and focus on working on those things before having like a little time to talk. And then the other one was to collaborate with other providers or have them come in with the visit with you to kind of help focus the mom and address the needs or um, talk about what they could do with Winnie to kind of help focus that in a little bit more.
Great. And then Colin, if your group wants to also do two.
All right. We kind of had those same suggestions, but we had a couple other ones that were from a different perspective. And one is kind of understanding that for a parent of a child in early intervention or possibly with ASD, it can be kind of lonely and it's hard to have social interaction. So maybe kind of recognizing that with the mom and perhaps connecting them to a social group. And then another would be what does the child's presentation look like? And are we having realistic expectations for both mom and child?
And this is why I love the case presentations because you guys have such amazing hands-on experience and are able to come up with some wonderful ideas and recommendations. Those are always also on our Canvas page, so you may want to go back and look at those to just see all the recommendations. I know it's hard to, when we come back, to give a summary of what was just discussed for the last 20 minutes or so. So feel free to go back and check those on Canvas. If all of the hub members or whoever you had take notes, email those to autismecho@aggies.usu.edu. Stephanie will compile all of those and email you out the list of recommendations. In January, so on January 22nd is our next session. And we will be talking about the early development and motor development of kids and autism. So please join us for that session. And everybody enjoy their holidays. Have a great end of year. I can't believe it's going to be 2025 in just a blink of an eye. So thank you all. Enjoy